This patient was referred to me for evaluation of tooth number 4 and tooth number 19 that I will show you shortly. But according to the patient, the root canal was done 2 to 3 years ago by his previous dentist. He went and saw his new dentist, switched dentist, and went and saw his new dentist, and he said his new dentist saw something on his x-ray and was a bit concerned. Patient denies having any symptoms with this tooth. I examined the tooth, percussion palpation within normal limits, probings 2 to 3 millimeters all around. And let's look at multiple angulation PAs together. And look at this PA here. You can see a periapical lucency here. And what is this? This could be a missed root, right? Missed canal right there. Okay. And again, periapical lucency. Look at the size of that post. Darn. All right. So that's one tooth. Again, this patient has no symptoms whatsoever. So, and percussion, palpation, all that were within normal limits. So in these cases, as you know by now, I don't just jump in and recommend endodontic retreatment. So I asked the patient to provide us with information, name of the dentist who did this root canal 3 years ago. So what we're going to do is we're going to request x-rays of tooth number 4 from the dentist who did the root canal 3-4 years ago, and we're going to compare and see what's going on here. If perhaps maybe periapical lucency was much larger, and that's why the dentist did the root canal, and now it's smaller, which means it's healing. So we just don't jump to a conclusion and say, oh, this is definitely an infection, absent symptoms, absent sinus tract or buccal swelling and all of that stuff. So anyway, so that's one of the teeth that the dentist wanted me to look at, and the other one was tooth number 19, and that's tooth number 19 here. According to the patient, the root canal was done about 8 years ago in Taiwan, and again, he has no symptoms. Percussion within normal limits, palpation within normal limits, probings 2 to 3 millimeters, but you can see definitely there's something going on here, periapical lucency here, and apical root resorption also. So again, this patient has no symptoms, and the tooth was within normal limits to all my tests. So we're going to request x-rays from the same dentist who we're requesting x-rays from for tooth number 4. He was a general dentist, so I'm sure he has a few PAs of tooth number 19 that he, I'm sure he took during a routine examination, evaluation, when he probably saw him first, this patient, 2 to 3 years ago. And then we're going to figure out what's going on here, or figure out whether or not we should just watch this tooth, or go ahead and recommend endodontic retreatment, or perhaps maybe possibly extraction if patient chooses to go that route. But right now, we're not going to be jumping the gun, and we're not going to immediately, by looking at a couple of PAs, conclude that this is an active infection when, as I said, patient has no symptoms. The tooth responded within normal limits to all our tests, and clinically there were no swelling, no sinus tract, fistula, or what have you. All right, so this is how you work up the tooth. You take your time, do your due diligence, and go from there.